Welcome to your West Coast General Hospital Endoscope patient journey, a video guide of what to expect of your upcoming surgical procedure.
Morning.
How are you?
Okay.
There you go. Nice for you.
Thank you.
There you go. Do you know where you're headed?
Yeah, I'm just headed to the OR.
Okay, great. Just over there to the admitting.
Okay.
All right. Thank you.
Once in the health square, make your way over to the admitting desk. The admitting clerk there will register you into the hospital. Make sure to bring your care card. The admitting clerk will apply an identification bracelet and direct you over to the daycare waiting room, where you can wait for the nurse.
Good morning, Susan. My name's Daniel. I'm part of the pre-op team. You got a bit of paper for me? Thank you so much. You're in the right place. We're going to have you get changed and look as though you belong here. Okay, if you'd like to come with me. A gown, a housecoat, and a pair of socks. The gown goes on first with the material at the front and the ties at the back. These were sleeves, but you wouldn't know it at the moment, so I'm going to do them up. There's a little washroom behind me that you can use as a washroom, of course, and as a changing room. And to maintain your decorum from the back, a gown to cover you up from behind.
Okay.
A little pair of anti-slip socks. They're much better than your socks because they are anti-slip, and a bag for your belongings.
Okay, sure.
Okay, when you're done, I'll come and find you with a warm blanket.
Okay.
Just confirming your name and your date of birth and your family doctor. You will see the surgeon and the anaesthetist before your procedure starts, so if you have any last minute questions about pain relief, you'll be able to do that. I have your signed consent form, so you've already spoken to the surgeon once, but that may have been a couple of months ago. We just clarify everything before the main event. I'm going to take you back to that waiting area.
Susan.
Yeah.
Hi, I'm Laurel.
Hi.
I'm an operating room nurse. Can you confirm your birthday for me?
July 28th, 1981.
Okay. And I'm ready to take you into the scope room.
Perfect.
Have you had a scope before?
Yes.
So you're familiar with this little walk. We're going to go into our scope room, which is just through these doors.
Hi, my name is Dr. Kushla Vijay, and I'm one of the general surgeons here at West Coast General Hospital, and I'm one of the people who carries out colonoscopies. Before your procedure, please make sure that you read the instructions carefully and thoroughly, and contact your doctor's office if you have any questions. We will take really good care of you here in the endoscopy suite. Please ask any questions before the procedure and we would be happy to answer. After the procedure, you'll be taken to the recovery room where the nurses will continue their care. And when you're discharged home, we will set up a follow-up appointment to discuss any relevant findings.
I'm going to put on some monitors for you, a blood pressure cuff, ECG leads. We're going to give you a little bit of oxygen. When the anesthetist comes, he's going to be starting an IV for you. I'm going to get you into position in the meantime, once we have the leads on. And we'll get going with the procedure shortly. Do you have any questions for the surgeon? No? Okay. All right. Okay, Rebecca, we're ready to get you into position. We're going to do the gastroscopy first. And then we'll change our scopes and we're going to do the colonoscopy.
Okay.
So in order to do that, I need to get you onto your left side, facing me. So I'll have you roll over. Once you're over on your side, I want you to scoot your bum to the far side of the bed for me. That's it. Knees up towards your chest.
Okay.
Yeah, perfect. Excellent. This is a funny little mouthpiece. It's going to go between your teeth.
Okay.
I'm going to wrap this around your head, and you're going to slowly drift off to sleep. We won't start the procedure until you are completely asleep. Off to the recovery room now. We removed 2 polyps from the colonoscopy. She has no allergies. A little bit of propofol. She handled the procedure well.
Perfect. Thanks very
Hi
much.
Susan. You've been with us for about half an hour now. I'm just going to sit you up and give you a little bit of a snack. How's your pain doing? Okay. We're going to take your oxygen off now. Oh, you might feel a little dizzy. You might feel a little twinge as I sit you up. Okay. And I'm going to give you a little bit of a snack because you're probably feeling a bit thirsty right now. Okay? So there's some water for you. And I've got some cookies, you've got some juice. Have as much or as little of it as you wish.
Thank you.
You feeling a little more awake now? Okay, let's go over what the surgeon did today. Then we're just going to take off your monitoring. Then we're going to get you up to the washroom and where you can get dressed. And I'll call your ride while you're in the washroom. Take as long as you need. There is a red cord on the wall, and if you need me for anything, you just pull that red cord and I'll come running, okay? Okay, Susan, take a seat in this wheelchair here. It's a long way to the car. So, I've got your instructions here, and your ride will be along shortly.
Ride is here. And who's picking you up today?
My husband.
Okay, super. We'll go meet him by the front doors.
We hope you have found this video helpful as you prepare for your upcoming surgical procedure at West Coast General Hospital. Know that we will do everything we can to support and guide you every step of the way. This has been an RSON film production.